Diagnosis: symptoms of type 1 diabetes often appear suddenly and are often the reason for checking blood sugar levels. Because symptoms of other types of diabetes and prediabetes come on more gradually or may not be evident, the American Diabetes Association (ADA) has recommended screening guidelines. The ADA recommends that the following people be screened for diabetes. Anyone with a body mass index higher than 25-23 for Asian Americans, regardless of age, who has additional risk factors, such as high blood pressure, abnormal cholesterol levels, a sedentary lifestyle, a history of polycystic ovary syndrome or heart disease, and having a close relative with diabetes. Anyone older than age 45 is advised to receive an initial blood sugar screening, and then, if the results are normal, to be screened every 3 years thereafter. Any woman who has had gestational diabetes is advised to be screened for diabetes every 3 years. Anyone who has been diagnosed with prediabetes is advised to be tested every year. Tests for type 1 and type 2 diabetes and prediabetes: glycated hemoglobin A1C test. This blood test, which doesn't require fasting, indicates your average blood sugar level for the past 2 to 3 months. It measures the percentage of blood sugar attached to hemoglobin, the oxygen-carrying protein in red blood cells. The higher your blood sugar levels, the more hemoglobin you'll have with sugar attached. An A1C level of 6.5% or higher on 2 separate tests indicates that you have diabetes. An A1C between 5.7 and 6.4% indicates prediabetes. Below 5.7 is considered normal. If the A1C test results aren't consistent, the test isn't available, or you have certain conditions that can make the A1C test inaccurate, such as if you're pregnant or have an uncommon form of hemoglobin, known as a hemoglobin variant, your doctor may use the following tests to diagnose diabetes. Random blood sugar test. A blood sample will be taken at a random time. Regardless of when you last ate, a random blood sugar level of 200 mg per deciliter, milligram per deciliter, 11.1 millimoles per liter, mmol/L, or higher suggests diabetes. Fasting blood sugar test. A blood sample will be taken after an overnight fast. A fasting blood sugar level less than 100 mg per deciliter, 5.6 mmol/L, is normal. A fasting blood sugar level from 100 to 125 mg per deciliter, 5.6 to 6.9 mmol/L, is considered prediabetes. If it's 126 mg per deciliter, 7 mmol/L, or higher on 2 separate tests, you have diabetes. Oral glucose tolerance test. For this test, you fast overnight, and the fasting blood sugar level is measured. Then you drink a sugary liquid, and blood sugar levels are tested periodically for the next 2 hours. A blood sugar level less than 140 mg per deciliter, 7.8 mmol/L, is normal. A reading of more than 200 mg per deciliter, 11.1 mmol/L, after 2 hours indicates diabetes. A reading between 140 and 199 mg per deciliter, 7.8 mmol/L and 11.0 mmol/L, indicates prediabetes. If type 1 diabetes is suspected, your urine will be tested to look for the presence of a byproduct produced when muscle and fat tissue are used for energy because the body doesn't have enough insulin to use the available glucose, ketones. Your doctor will also likely run a test to see if you have the destructive immune system cells associated with type 1 diabetes called autoantibodies. Tests for gestational diabetes. Your doctor will likely evaluate your risk factors for gestational diabetes early in your pregnancy. If you're at high risk of gestational diabetes, for example, if you were obese at the start of your pregnancy, you had gestational diabetes during a previous pregnancy, or you have a mother, father, sibling or child with diabetes, your doctor may test for diabetes at your first prenatal visit. If you're at average risk of gestational diabetes, you'll likely have a screening test for gestational diabetes sometime during your second trimester, typically between 24 and 28 weeks of pregnancy. Your doctor may use the following screening tests. Initial glucose challenge test. You'll begin the glucose challenge test by drinking a syrupy glucose solution. 1 hour later, you'll have a blood test to measure your blood sugar level. A blood sugar level below 140 mg per deciliter (7.8 mmol/L) is usually considered normal on a glucose challenge test, although this may vary at specific clinics or labs. If your blood sugar level is higher than normal, it only means you have a higher risk of gestational diabetes. Your doctor will order a follow-up test to determine if you have gestational diabetes. Follow-up glucose tolerance testing. For the follow-up test, you'll be asked to fast overnight and then have your fasting blood sugar level measured. Then you'll drink another sweet solution, this one containing a higher concentration of glucose, and your blood sugar level will be checked every hour for a period of 3 hours. If at least 2 of the blood sugar readings are higher than the normal values established for each of the 3 hours of the test, you'll be diagnosed with gestational diabetes. If you want to know more details about the method, follow me now.